Welcome to our series of Being Pregnant in a Pandemic, a guide to prenatal care for low-risk pregnancies. My name is Salwa Farooqi, and I'm a third-year medical student at the University of Toronto.
And I'm Dr. Tanzila Basrin. I'm a family and emergency physician in Toronto and Lindsay, Ontario. We are on video number 1 of a 7-part series on managing your pregnancy during the pandemic. As you follow along, feel free to pause or even download our handouts as a good guide for you to keep with you at all times. Today, our goal is to talk about what to do when you think you're pregnant and the first steps as you go to your primary care provider.
Please take a moment here to fill out our anonymous pre-survey. Every video series will have a pre and post survey for you to fill out. It will help guide us on making better educational videos for the future.
All right, so you think you're pregnant. Now, what do you do? Salwa, tell us about the schedule.
Right. So, we'll be kicking off our series on weeks 0 to 12. Usually, you are seeing your healthcare provider around 13 to 14 times throughout your pregnancy, depending on the need for it. So starting off in the first trimester up until 7 months of your pregnancy, your visits happen every 4 weeks. And then those visits become more frequent after 7 months to every 2 weeks during the COVID-19 pandemic. You may experience 4 less visits for your prenatal care. And so these visits could look like phone calls, video chats, or in-person visits, and that's totally up to your healthcare provider. Now, a lot of you are probably wondering, will the shortened schedule cause harm to my baby? Well, Dr. Basrin, what do you think?
So that's a great question and a commonly asked one. So research really does show that changes in the shortened schedule will not harm your baby. When compared to those who follow the full schedule, pregnancy outcomes were not affected. And always remember, we're still here for you if you need us. So just give us a call and we can still address any needs as they develop. So what if you are pregnant? What do we do next? So the first thing that I always want to educate patients on is, how do you know that you're pregnant? So we can start with things like signs and symptoms. That includes missing a period, feeling nauseous or even vomiting, having some breast tenderness, cramping, and minor bleeding may sometimes be seen, and fatigue. Now, any of these signs may initiate you to do a home pregnancy test. The best time to do one of these tests is a week after you've missed your period. And if you don't want to wait, then test 1 to 2 weeks after having intercourse. More accurate information is found as you wait longer. But the most important thing to make sure you bring to your healthcare provider is the first day of your last period. Next, let's say you go to your family doctor and you're still confused because the test wasn't really conclusive. So in office, we can discuss whether a blood or urine beta-HCG test would be beneficial for you. This can detect pregnancy even a week before your period is due. But the more you wait, the more hormone you develop in your body and the better the detection rate. This hormone really does peak around week 8 to 10 of the pregnancy. Lastly, ultrasounds. Now this is really based at the discretion of your care provider. Not everyone needs an ultrasound, and during this pandemic, we do recommend fewer in-person visits, whether it's for a test or to a physician. And so according to the guidelines, we could wait up to 20 weeks to do the first ultrasound. Now, with some patients, you can have irregular periods and the date is hard to determine. And in those cases and numerous other cases, at your healthcare provider's discretion, an ultrasound may be done right away. It's important to note that these ultrasounds are done both over the abdomen and intravaginally, so don't be surprised at your visit. Now, the next thing is, when do you go to the healthcare provider? So you think you're pregnant and now you want to book an appointment. The best person to talk to obviously is your family physician if you have one. An alternative could be a walk-in doctor or even a midwife. Your healthcare provider may not be able to see you in person during the pandemic, but definitely may arrange a video or phone call for the next steps. At that point, during the appointment, they will discuss blood work, various counseling tips, and potential ultrasound if it's indicated for your care. Again, Something to think about during these visits would be whether you want to be followed by a family doctor who specializes in OB, an obstetrician, or even a midwife. So start looking at what your options might be. The next most commonly approached question that I have is on nutrition. So the most important thing that I say is that there's really no special diet other than the most healthy diet you can provide to you and your baby. Follow Canada's food guide, and note that in first trimester, there really isn't any extra calories that you're supposed to take other than what you normally have. Obviously, these calories should be the most nutritious possible, and we recommend having lots of fruits, vegetables, protein, and whatnot to make sure that you're well nourished. As always, we always advise patients who are planning or even pregnant to take prenatal vitamins. And these vitamins usually contain 400 micrograms of folic acid and a bit of iron. If you are prone to iron deficiency anemia, this may be something that would be added to your first trimester blood work. The other thing that everyone asks me is about caffeine. So we really would like you to limit your caffeine as much as possible, and the recommended guidelines state that 150 to 300 milligrams a day would be the safest. Also avoid food high in mercury, such as large fish, and other items such as liver or undercooked items such as sushi. So typical weight gain usually is between 6 to 15 pounds in the first trimester, but it all depends on your pre-pregnancy weight. So the best person still to consult is your primary care provider, whoever that may be, to make sure that you're progressing along well. Next, exercise. So we love exercise, and it's very safe in low-risk pregnancies. A brisk walk, swimming, and yoga can really make you feel better and help throughout the pregnancy. Something that we do want to make sure is that you're avoiding hot yoga, contact sports, horseback riding, or other activities with high risks of falls or trauma. As always, check out our handout and even watch the YouTube links below to see more resources on how to best exercise. Other things that I love to talk about in first trimester counseling include what to avoid. So if you have a cat, we recommend that you avoid changing the cat litter due to a risk of toxoplasmosis. If you have questions about this, please talk to your doctor. If you work with children, maintain good hand hygiene as always. And if they're sick, and generally you want to avoid sick contacts. There's really no safe alcohol limit, so please don't drink. And if you need help with that, talk to your doctor. Smoking also is known to negatively impact the baby, whether that's regular cigarettes, e-cigarettes, marijuana, or any other forms. Again, ask for help to quit because we're always here to help you through this. So some of the common issues that we see during pregnancy are nausea, vomiting, bleeding, constipation, and back pain. Today, I'm going to focus on the first two because they're the most common in first trimester of pregnancy, and the other two will be covered as you progress through the pregnancy. So nausea and vomiting. This is the most commonly encountered problem in first trimester of pregnancy. It usually self-resolves with conservative management, which can consist of staying hydrated, having small frequent meals, which means maybe 5 to 6 small little meals every 2 to 3 hours instead of 3 large meals, chewing on ginger, having soda crackers or bread first thing in the morning. And so what I advise is to have a little soda cracker right beside your bed and just put it in your mouth before you even get up. The other thing I recommend is to avoid trigger foods. You'd be surprised at what may be a trigger. So always keep a food diary if you find that there are some food items that don't really suit well. The other advice would be to drink fluids 30 minutes before a solid meal, again, just to allow the gastric emptying as you get pregnant. Things get slower. And if none of these are helping, please talk to your healthcare provider, as we want you to avoid any over-the-counter or herbal remedies without seeking their advice. Again, we do have options and we want to help you. There are lots of safe options out there, so just speak to your doctor if none of these are working, and we'll be more than happy to help. The next thing that we sometimes see is bleeding. First and foremost, please don't panic. Bleeding doesn't necessarily mean that this will lead to a miscarriage. That being said, 80% of miscarriages do happen in the first trimester. And so any bleeding in pregnancy does require medical attention. So start by giving us a call, booking an appointment, and seeing us. Now, if you have bleeding with pain, we recommend that you go to the emergency department because it would be important to really check the status of your pregnancy then and there live. If you know that your blood type is negative, meaning when you have that letter, it's A negative, O negative, or what we call RH negative, remember to tell your care provider, whether it's at the emergency department or your primary care provider, and make sure that they check it as a precaution. Now, let's move on to the most frequently asked question during this pandemic. What if I have COVID? Again, great question. So let's find out more.
What do you do if you might be COVID-19 positive? Well, it's important to note that care for pregnant women positive for COVID-19 is actually similar to the non-pregnant women. So currently, there is no medications or vaccinations available to treat COVID-19, and around 80% have mild to moderate symptoms and recover on their own. And so you might fall into this category. Treatment is supportive, so that looks something similar to when you have a normal cold or the flu. And supportive treatment looks like staying at home, self-isolating, bed rest, taking lots of fluid and honey for your cough, and pain relievers for any body aches and pains. We recommend acetaminophen or Tylenol, which is safe in pregnancy. What we don't recommend using is our NSAIDs or non-steroidal anti-inflammatory drugs like ibuprofen, Advil, Motrin, naproxen, or Aleve. Now, again, it's important that you're in charge of your own health and you're monitoring yourself for any worsening symptoms. If you're not sure, make sure you contact your healthcare provider for further guidance.
So, let's say you're really not feeling well. You have increased shortness of breath and are having difficulty breathing. As an emergency physician, this is my number one concern. If you have any of the warning signs on this slide or really feel very unwell, this is a reason to seek immediate medical attention. If your family doctor or walk-in physician is very easily available, give them a call. Otherwise, this would be a visit to the emergency department. A lot of people during this time are afraid to go to the emergency department, and I want to assure you that we take extreme precautions to make sure that your safety is priority.
Now let's talk about prevention, and prevention. I'm sure a lot of you have heard about this over social media or the news, and we really want to drill the concepts home. It's really important that you should be doing these things so that you don't get sick in the first place. Maintaining social distancing. That's very important, especially now that things are opening up. It's important that you still try to stay at home as much as possible and limit your contact with people. Wash your hands frequently. Now, this is important before the pandemic and outside of the pandemic. So make sure you're washing your hands, especially after you touch dirty surfaces. Wear a mask when going out. Again, a lot of people are starting to take the pandemic a little lightly as things are opening up. It's important that you recognize that you are pregnant and we don't know what the risks are to your pregnancy. So wear a mask whenever you are going out. Keep objects and surfaces clean. Anytime you touch something, make sure you clean and wipe that. Don't touch your eyes or nose or your mouth. Those are areas that lead the virus to get into your body. And of course, take care of your mental health, and that's very important. If you are feeling very anxious or overwhelmed by the pandemic and the news that you hear constantly, please do contact your healthcare provider and seek help. The diagnosis for COVID-19 is a simple swab through your nose. While the possibility of COVID-19 should be considered in people with fevers, chills, cough, diarrhea, or shortness of breath, you should try to seek medical attention with your primary care provider, who may send you to a hospital or a COVID-19 assessment center if they have any concerns. So testing can be done if it's needed, but always speak to your primary care provider on what's best for you. And of course, don't forget to fill out our anonymous post survey. So this is the second survey to our educational resources. We want to know how our videos have impacted you. And of course, don't forget to download our resources or our handout sheet that is available in the description box below. All
right, congratulations everyone for making it this far. Don't forget to watch our next video to see what's coming up next in the course of your pregnancy. Hope to see you soon. Take care, everyone.